Coming up in September all month long, it is the Peripheral Artery Disease Awareness Month. And here to tell us a little bit more about that, Dr. Will Harris. He is with the Vascular Institute of Chattanooga and with Dr. Chris Lasar. Dr. Will Harris, good morning.
Thanks, Chip, for having me. I appreciate it.
PAD Awareness Month. Tell us exactly what this is in a nutshell.
Peripheral arterial disease is an epidemic across the United States and across the world. Upwards of 20 to 30% of people over the age of 55 have some form of peripheral arterial disease.
Wow.
And only 25% of those are undergoing treatment. So it can manifest itself in a tremendous amount of ways, and in highest risk in the older we get.
How do you know if you have PAD?
Leg cramping, non-healing wounds, those are the most common forms of peripheral arterial disease or the most common symptoms of peripheral arterial disease. Non-healing wounds, a wound on your toe that's just not healing for months on end, cramping while walking, pain, swelling, things like that in your leg. It can manifest itself in other ways. It can manifest itself in carotid disease that can cause stroke.
If you are diagnosed with PAD and you make it to the Vascular Institute of Chattanooga, which is where you should go, what's the first step that you guys doing after confirming the diagnosis?
Well, the patient is seen by a provider, and then we order the appropriate tests, and most of the time those tests are ultrasounds, which are non-invasive studies, cause no harm to the patient, and they're simple, pretty quick tests that can determine whether or not they have it, and then we establish a treatment algorithm.
Is this something that patients recover from?
Oh, very well. And patients do extremely well. Most of the procedures are outpatient procedures that we do in our office. A lot of patients don't even need interventional therapy and can be managed appropriately with appropriate medications, exercise therapy, smoking cessation, adequate treatment of their diabetes, so on and so forth.
All right, coming up also in September, you have since you're the Vascular Institute of Chattanooga, you're having the Victory Run. Tell us a little bit about that.
Yeah, it's out at Camp Jordan. It's on September 11th. It's co-sponsored by our partners at Park Ridge. And get out there. There's a 5K, there's a 10K, there's a kids run as well. My kids will be there. My wife's running the 10K, I think. I just threw her under the bus. So I think it'll be a great event. And all those proceeds go to funding uninsured patients in Hamilton County and Bradley County.
Which Dr. Lasar has been active in doing for a number of years.
Yep.
Dr. Chris Lasar and his wonderful wife, Tracy. You have been with the Vascular Institute of Chattanooga for how long now?
Approximately 1 year. I moved here from San Antonio after getting out of the Air Force.
Thank you very much for your service, and thank you
Thanks.
much for sharing
It's
a
our
little
pleasure.
bit of your time. You can find out more about the great stuff they're doing at the Vascular Institute of Chattanooga. It's only a mouse click away, or you can find out more about the run itself. You can go to vascularinstituteofchattanooga.com, vascularinstituteofchattanooga.com.